Hello, and welcome to BioHealthOhio, where we focus on restoring hope and health. If your search for better health has taken you down many paths, but you're still struggling to obtain the answers and improvements you need to be truly healthier, then your path to wellness may actually start here. Our mission is to restore health and hope by finding and treating the underlying causes to your health challenges while providing customized, natural, and drug-free care that often will lead you down a path to optimal wellness. So hello, my name is Dr. Siegel. I'm the medical director of BioHealth Ohio in Columbus, Ohio. I practice functional toxicology, functional medicine, and neurology, and nutritional and energetic medicine since 1983. I'm board certified in nutrition and hold the postgraduate specialty degree of diplomate of the American Clinical Board of Nutrition. I'm also certified in Dr. Tatis Karazian's program of Mastering the Thyroid, along with Dr. Dale Bredesen's RECODE protocol for reversing Alzheimer's disease. On a daily basis, I encounter patients who have become hopeless in regards to their health struggles. They have usually spent thousands of dollars, been to numerous doctors and practitioners, and still have fallen short of getting full explanation of what's wrong, let alone seeing their health improve to any large degree. Are you that person still trying to improve your health but no real traction? Maybe you're looking for a different road to travel, perhaps one that's not littered with drug options only. Perhaps you just need someone who will really listen and who looks at a much bigger picture and then able to tie all the pieces together. Your symptoms, believe me, are not just in your head, they're on your mind. So no matter your struggles, no matter where you live, no matter your lack of successes, I'm here to listen and to help. I'm dedicated to directing all of my experience, knowledge, and insightfulness to serving you at the highest level possible. So how do I do this? I help by using a unique, holistic, non-drug functional medicine approach where I look at the whole person and how all the body's systems constantly affect each other, aiming to optimize the functioning of the organs and their interconnectivity with each other. This important model seeks to find and correct deep underlying causes of disease rather than just trying to cover up the symptoms. I do all this through my cutting-edge testing and powerful treatment methods. Paying for sick care is very different than investing in health. Through investing in your health, it starts to redirect the downward spiral of your train away from further decline and more towards getting your life back, both in quality and quantity. While I would love to be able to help 100% of people, I can't. But what I can do is give 100% effort to you. That is why I will only choose to work with those patients who are truly committed to investing in their health. So if you are committed and able, then you will certainly benefit from my process of care. So our approach is a three-pronged aspect where it embodies functional toxicology, biochemistry, and functional neurology. While chronic conditions are the norm in my day-to-day practice, I still may help those who have acute issues as well. So let me break down each prong to my approach. The first prong is what I call functional toxicology. When you think about the environment we all live in, there's no escaping the toxic nature of it. Toxins are all around us, in the air we breathe, in our food, our drinking water, things like carpet, paint, furniture, cleaning products, personal hygiene products, cosmetics, and so forth. We are the first generation to be exposed to such a high number of man-made chemicals on a regular basis that the onslaught of symptoms and disease is pretty much a guarantee in most people's lives. The burden has become so great that the average newborn has an average of over 200 toxic compounds in its umbilical cord blood upon birth. And the one thing to keep in mind, toxicity will lead to chronic inflammation, which then leads to disease. There is absolutely no doubt that today's toxic exposure certainly become tomorrow's health problems. I have been in practice over 37 years, and this fact is continuing to become worse. The greater the toxic load, the greater amount of chronic inflammation, the greater the chance of disease and suffering. Due to this constant toxic assault on our bodies, it's no longer an option of applying effective detox efforts. It's now a foundational necessity. Cleansing your body of accumulated toxins is one of the best, if not the best, way of boosting your health and well-being, along with reducing your chances of developing chronic disease. Our method of functional toxicology delivers customized cellular detox while providing organ and tissue support. Dr. Bittard, DO, once said, "In my opinion, based upon the evidence, every single chronic insidious disease process is related to one word: toxicity. You cannot address the issues of aging and disease unless you address detoxification." From a testing standpoint, we do use chemistry testing like blood work, which provides very useful information, but oftentimes it falls short in providing enough understanding and insight about the possible underlying causative factors. Therefore, I'm forced to use the outside-the-box approaches that can afford me better insight to underlying causes of one's health struggles. I use a form of brain reflex testing through which I monitor a sequence of reflexes exhibited by the body in response to numerous stressful events or elements. In order for the cells of the body to get things done, they must be able to effectively communicate with and amongst each other. While most people are aware of the fact that cells communicate through a language of chemistry, thus doing blood work allows us to kind of eavesdrop into that language to see what might be going on, our cells have a second language or way by which they communicate to create action and reaction. This second language is through physics, or in the form of frequency, if you will. In fact, when the body needs to respond or react, cellular communication occurs with the exchange of frequencies, which then tells the chemistry what to do. The language of frequencies may sound strange or bizarre to many people, but the fact is that we've been using the principles of frequency for many, many years. Examples of everyday life include things like GPS, TV and car remotes, cell phones, Wi-Fi, MRIs, and more. When it comes to evaluating the presence of and impact from toxic exposure, there is no better way than through eavesdropping into the frequency site of cellular communication. By doing this, we're able to pick up even the slightest distortions, even before blood work is able to clearly show a problem. From a testing standpoint, a couple things to keep in mind. The testing is very safe, it's non-invasive, and it's non-painful. It allows me to find the location of the impacted organs or tissues and what is causing, or what's the type of toxic burden involved. The process of testing is actually reflex-based. It's not a muscle test. And basically, a reflex is a stress response, which kind of act like warning signals that alert and protect us from some impending danger or stressor. A perfect example of a stress response or reflex is the pupil reflex. It opens and closes due to stressor of too much or not enough light. Some of the equipment used we have the use of testing vials, and these are glass vials that have contents that act as potential stressors to the body. Each vial contains a specific frequency that coincides with either a healthy tissue or organ or a toxic element like metals, chemicals, radon, mold, parasites, and more. There is a testing plate and testing rod that's made out of high-conducting aluminum. The plate and rod provides a mean for the vial's frequency to be conducted to the cells of the patient's hand because the person is holding on to the testing rod. From there, the specific frequency is then interpreted by the brain as being a stressor or not. If the brain perceives the frequency as a stressor, then a reflex response occurs, and in this case, it's a shortening of the right leg. The testing is pretty easy. We first have people just turn their cell phones off, remove any items in the pockets like jewelry, watches, and things like that. Pretty much just take the shoes off. At that point, we have the person laying gently and softly on a testing bed, usually a massage bed. And I start the exam by gently placing my hands on the patient's ankles. I use a very sophisticated algorithm as to what vials I select to act as possible stressors and to see if a stress reflex in the patient's right leg occurs. Evidence of a stress reflex will demonstrate by a subtle tension in the patient's right leg, which will then cause a pulling up or shortening of that leg. This process is then repeated in a very specific sequence until adequate information has been obtained regarding the toxic load within the specific body's tissues. During the testing procedure, the patient does not feel any sensation. There's no danger to the process, and it's totally safe and comfortable and actually relaxing to the point that many people fall asleep while the testing is done. Testing will take approximately 45 to 60 minutes initially. Immediately following this first test, your results will be discussed along with the findings of any additional lab testing that we may have done and how all of this might relate to your health. And then at that point, I will make treatment recommendations to see how we might want to proceed. Follow-up testing appointments uses the same procedure as the initial testing, but these are only about 30 minutes in time frame. And this follow-up testing occurs about every 4 weeks. The frequency of follow-up tests will be dependent upon your response to care and the degree of remaining health issues. Evaluation of your health issues are done through this method of functional toxicology that allows me to effectively find and safely remove the toxins that can often be major contributors to your disrupted health picture. The homeopathic treatments that I will make are targeted specifically for you based on your results. Your health issues are unique to you, and I tailor your treatment to safely remove specific toxins to improve imbalances of deficiency and improve organ function in order to get you feeling and functioning better. The treatment protocols are very easy to take. The homeopathic liquids are used to both safely and effectively stimulate the body's own immune system to promote the elimination of toxins, while also providing support for normal tissue functioning. This then unlocks the full power and potential of the body's self-regulating function to promote and maintain optimal health. I am only one of a handful of practitioners trained and certified in this method of toxicology. I'm the only practitioner in the state of Ohio using this method. I'm also an instructor and mentor for students learning this method and have trained students from all over the world. New homeopathic liquids will be provided every 4 weeks after every testing appointment. Detoxification will occur throughout the length of your treatment plan. On average, patients will require about 12 months of retesting and treatment to stabilize their condition and bring about an improved chance of consistent relief and improved function. Through consistent and targeted treatment, stabilization of your health can occur. I have developed what I call my stabilization program. This is my primary approach in trying to slow the runaway train down that is going down the track in the wrong direction. We're trying to help pump the brakes in order to stop the train and reverse its direction. The next prong of my approach is to look at the biochemistry of the person. This component of my functional medicine approach involves evaluating and treating the body's biochemistry or metabolic imbalances. All systems and organs are linked together directly and indirectly. Therefore, it's important to look closely at various patterns between the organ systems and determine what underlying mechanisms are contributing to a person's hormonal, nutritional, and/or biochemistry imbalances. Treatments are directed through the use of specifically targeted nutritional protocols that have been determined to address each person's unique metabolic needs. Most often, the beginning step is to do a comprehensive blood workup. However, either initially or at a later point in time, additional testing may be recommended, depending upon each person's health history and needs. It may include things like adrenal testing, gluten testing, male-female hormone testing, immune system evaluation, and so forth. Treatments are directed through the use of specifically targeted nutritional protocols that have been determined to best address each patient's unique and individualized needs. It is not a one-size-fits-all, nor is it loading up a person with excessive amounts of nutritional supplements. I work towards achieving biochemical balance and function with the minimum amount of nutritional supplementation or making any drastic dietary changes. The final prong of my approach is using functional neurology. Your brain is the commander-in-chief. Everything that happens in your body is controlled by your brain. Things like your heartbeat, breathing, digestion, ability to see, taste, smell, and hear, memory, balance, emotional stability are all directly correlated with proper brain function and communication. Normal functioning of the body can also result if the communication between the brain cells, called neurons, and with other parts of the body are firing or communicating at an appropriate pace and power. It stands to reason that if you improve the function of your brain, you would improve the function throughout the entire body. Functional neurology as a healthcare discipline is a relatively new concept. Over more recent times, there has been a growing interest in application in the areas of improving brain performance through the principle of neuroplasticity. Neuroplasticity essentially means that your brain and nervous system can be made to work more efficiently and even regenerate. Thus, the primary goal of utilizing functional neurology with my patients is to apply this principle for the sake of optimizing my patients' brains and lives. During the new patient consultation, I will determine who I feel would benefit most from being evaluated neurologically. If one qualifies for such an exam, I will look at your brain from a hemispheric perspective, that is, how the left hemisphere, left side of the brain, is working in relation to the right hemisphere. In doing so, I can reveal which parts of your brain, whether the cerebellum, the brainstem, the cortex, are not communicating properly. I may also perform what's called an HRV, or heart rate variability test, to look for imbalances between the sympathetic and parasympathetic parts of your autonomic nervous system, sympathetic being the gas pedal, parasympathetic being the brake mechanism. This test demonstrates what impact of stress is having on the brain and nervous system. From a treatment perspective, it's based on the examination findings, and I recommend therapies that can be utilized to help improve the areas of weak brain communication. So through my three-pronged approach, I have had good success in treating a wide variety of conditions and symptoms, even ones where patients have not found results elsewhere. Things like Hashimoto's or autoimmune thyroid, cognitive decline, ADD, ADHD, brain fog, irritable bowel, and more. Depending on where you live, I will see you either at our Columbus clinic or meet with you through our virtual practice for your initial consultation. For patients that move forward, I strongly recommend seeing you in person for your initial exam and report of findings. However, if you are unable to travel to our office, we can complete these appointments through our virtual practice. For those traveling from a distance, our wellness team can help you plan your visit. It is strongly encouraged that you have a friend or family member with you during both your consultation and your initial exam. I welcome seeing all of you who will support your health journey, and I'm happy to answer any questions they might have. Our goal at BioHealthOhio is to help patients achieve an optimal level of wellness through using our unique three-pronged non-drug approach. Our functional medicine model focuses on finding and correcting the deep underlying causes of dysfunction and disease so that true healing can take place. This How It Works guide outlines this orderly process in which our clinic operates. Should you have any questions, please don't hesitate to contact any of us here at the office. We are certainly here to help. If you're unable to travel to our Columbus office on a monthly basis, you will be participating in our virtual practice. This process is slightly different. A member of my team will go over the details with you prior to your consultation. For more information on the virtual side of the practice, you can go to www.drsiegelvirtual.com. So prior to the consultation, here's the steps that you go through. Complete qualifying questionnaire and watch the pre-consult video that you are currently doing. The first step is to schedule a new patient consultation and complete our qualifying questionnaire. Once this is submitted, someone from our wellness team will reach out to you to schedule an appointment. Please allow 24 to 48 business hours for this. The pre-consultation video. This video is located on the same page as the qualifying questionnaire and is required to be watched in full before you can schedule an appointment. Step 2, paperwork. Once your new patient consultation has been scheduled with a member of our wellness team, you will receive an email prompting you to complete our new patient paperwork packet. This is done entirely online, and all paperwork must be completed a minimum of 24 hours before your appointment is made. If it's not completed, the appointment will be rescheduled. At your consultation, I will discuss your health concerns and goals, review your present and past health history, review any prior labs, treatments, and provide discussion, and I'll make an initial examination or lab testing recommendations. I will give my recommendation as to which treatment plan best fits your case as well, and then obviously answer any questions that you may have. After the consultation, a member of our wellness team will provide you with the appropriate lab forms or kits if applicable. Fees will be collected at that time for lab testing. They will schedule your next follow-up visit for your initial exam and to review and discuss all lab testing findings. Typically, visit number 2 is scheduled 2 weeks out to ensure we have received all test results before you come back. If you're unable to get your labs done in a timely manner, your second visit may be scheduled out a little bit further. We will also have a team member provide a breakdown of details, cost, and financing options, if applicable, of the treatment plan that I've recommended. You will be given detailed information after your in-person consultation so that you can make an informed decision about how you want to move forward by your next visit. After the consultation, but prior to the initial exam, you, the patient, will get your blood work or labs done as soon as possible, if applicable. Review the service and cost breakdown information given at the first visit. Please be ready to make a decision on how you want to move forward with care at your initial exam or visit 2. If there's financing that you need to apply for, you will be given that information regarding advanced care, and you will apply for that. The initial exam report of findings. At your initial exam, I will complete the initial toxicology exam and any other exams previously discussed. I'll review all lab and testing results. I'll answer any questions you may have. I'll ask for your decision on how you might want to proceed with care. I've asked that you may have made a decision and made necessary financial arrangements if needed so that we can get you started on your path to wellness immediately. For those that commit to care, a member of our wellness team will complete your onboarding process and walk you through each and every step and answer any questions that you may have. Okay. Our care team consists of 3 individuals. I'm on the left here, Dr. Siegel, practice manager, office manager, Emily Siegel, and our wellness coordinator, Monica Dodd. So at any time, most often, if you have communication over the phone or email, it's going to be probably with Monica and or Emily. My staff and I sincerely want to help you start on your path to wellness and to provide true hope that a healthier tomorrow is possible. I want to thank you for taking your time to watch this video. We truly hope to be the place where wellness begins for you. Here is all of our contact information. Make sure you sign up for our office newsletter called The Drop. There's a lot of really good health information that's provided, and it's certainly not a sales pitch at any time. Also, make sure you download my free report about the 4 triggers of inflammation and our unique detoxification strategies for the long-term health of you and your loved ones. Be sure to share the downloadable report with others as well. That's it for now. Take care, and we wish you a healthier future.